So you may have been to a chiropractor before, and how I practice, it is so different compared to other chiropractors. My goal is to elevate the standard of healthcare and chiropractic. I believe chiropractic means so much more to help patients. You may feel that way too. I want to show you what I do that's different. It's called chiropractic biophysics. One of the tables that I use is called a Denneroll table. This table is so amazing to help patients not only recover in their health, but actually make permanent, long-lasting changes that maybe other chiropractors weren't able to help you with. So what is this Denneroll table? It's an amazing table that you would lay on. Now, right now you see the table, there's nothing on it, right? This is before a patient would come on. But what I can do is I can change the angles, which you can see on this big arm component, depending on what area of the spine I need to pull on to get correction of. So you may have a herniated disc due to postural shifts in your lumbar spine and your mid-back thoracic spine. That could be putting extra stress and pressure on the discs, affecting the nerves. And then you may get diagnosed with spinal stenosis. You may get diagnosed with degenerative disc disease, maybe neuroforaminal compression, maybe sciatica. All different types of names to show what the effects of are due to abnormal posture, abnormal alignment of the spine that causes these different names of diagnoses that you may get. I want to tell you though, you're more than just a diagnosis. You're a person that can heal and will heal in the right conditions. What is the right condition? Optimal spinal alignment. What is that? Well, that's determined based off of what I see with your x-rays. That's why I take them. And then also determine mathematically where your spine should be, which is everything I analyze at the office. And then from there, I determine where your misalignments are. I put you on this table. I put you in a very specific type of spinal corrective traction. This is different than typical tractions out there that just pull your spine. This is designed to actually get you into the right alignments, which when you're in the improper alignment is what causes different diseases. Now from here, I change the angle. I may pull with different straps like this one. This one I use for the neck. Maybe you have reversal of the neck curve. Some people call it military neck or straight neck. Or a lot of people, due to flexion distortion that we live in, start developing these abnormal postures. Maybe you were in a car crash years ago. That can cause whiplash-associated injuries. That quick whipping motion can literally change your spine from normal curve to abnormal curve like that. And that's going to make you live, unfortunately, in chronic health issues. So I will place this right here. I change the angle. And then also, let's go for the lumbar spine. I use this strap right here. I put it down. I can change the angle depending on what area of the spine is misaligned. And then I pull there, gets proper curve in the spine. That takes pressure off the discs. That takes pressure off the nerves. And that's what allows you to heal. This is why I practice chiropractic biophysics. I believe that you deserve the highest standard of care and the highest standard of chiropractic. And I know if you're watching this, you believe that too. So that's what I do at Optimal Spine and Body.